Everybody's noticing them. They're film star teeth now.
Film star teeth.
Much more improvement on what I had. I've got the wow factor going. Wow, Denise, what have you done?
Excellent.
So that's a plus.
Hi, welcome. My name is Dr. Caroline Downing. Today we're going to talk about treatment that can improve your smile. Today we're going to talk about veneers. And veneers are used to reshape, recolor and reposition teeth into the perfect positions. A veneer fits over the front surface of the tooth, but we can change the shape of the tooth slightly with that, and we can make them a little bit longer. So we can restore the original form and function to how it was previously. So today we have Denise here, and Denise is going to talk about her experience with porcelain veneers. Hi Denise, how are you?
Very well, Carolyn.
So can you tell me a little bit about why you decided that porcelain veneers was your treatment of choice?
Well, apart from the smile, apart from the confidence, I really wanted to hold off on the puree food. The thought of eating a steak through a straw, I didn't want to do that just yet.
Yeah.
And that's what it was happening. My original teeth were thinning, bite into a nectarine, eat my steak on my chop, and I was in meltdown, a bit of chip away. They went from terrible, discoloured, thin, fragile, brittle, you name it. They went from that to film star teeth.
And they are too. They're gorgeous.
And everybody's noticing them.
Yeah?
The young people in particular. I've got the wow factor going. Wow, Denise, what have you done?
Excellent.
So that's a plus.
Some people worry that sometimes that the top teeth are not going to match the lower teeth after the treatment. So we did some bleaching, some home bleaching for you. Yeah. So we made some little trays. You put the bleaching solution in. So it means that the teeth are much more natural and compatible. So you can go a little bit lighter on the top ones, but it still blends and is harmonious with the lower ones.
And that was a very simple procedure, just to do at home, watching telly. It was no trouble at all, and it did make a big difference.
The first appointment is where we actually prepare the teeth, and at that point we make temporary veneers which go on. And Denise, just tell me a little bit about, so with the temporary veneers went on, it gave you a really good indication of how the permanent veneers were going to look.
Well, it did, and I thought, oh, well, these look pretty good. I mightn't have to go any further. But you said, no, Denise, they will not last. Yeah. But they certainly did the job. They lasted as long as they had to. I had no trouble, and I could eat well.
No sensitivity with the veneers, the temporary veneers.
Very fortunate.
That's good.
Nothing.
So with the actual appointment where we prepared the veneers, it was a long appointment, wasn't it?
Yes,
it was a long appointment. And we did make you numb so that you didn't feel any of the procedure.
Felt nothing.
But we actually did something. We gave you something else, which also helps the.
Well, I don't open my mouth, as you know, unless I get happy gas, even for a clean or anything. So with the gas and the injections, it was a walk in the park.
So the happy gas, describe it to me. It's a little bit. You have a little mask that just goes over your nose, but you still can talk to me and so how does it make you feel, the happy gas?
It takes away any fear of the dentist, which I think a lot of people, particularly my age, have experienced, because you know how far you've come with dentistry as compared to the dark ages when I first went to the dentist, and it wasn't the experience that it has become now. And coming to you, well, I wouldn't go anywhere else anyway.
Oh, that's
so, and as you know, my grandchildren come, my daughter comes, and since we've met you, that's it.
Yeah, very
that's
good.
That's it for us.
Very good. Well, I'm glad that you feel that way, and also glad that the gas makes it a pleasant experience for you.
And there's no aftermath either.
That's it.
As soon as the mask comes off, I feel no effect.
So we give you 100% oxygen for 5 minutes after you've had your treatment.
No problem.
After the veneers were put on, was there any problems actually in the eating and chewing. Did you get used to the eating and chewing quite quickly?
Well, quite quickly, because I'm such a good eater, I never have any trouble. Not with these. These have just made such a difference. I'm confident. I can eat everything I like, even my nuts. And I'm addicted to nuts. And I'm a big meat eater. So I'm right.
Excellent.
So no, it was a great process, and I would recommend anyone to have it done.
Right.
Don't be frightened, just get it done.